Hello, welcome to our health promotion webinar. The title of this afternoon's webinar is Looking After Your Sexual Health. I'm delighted to welcome Hugh Williams from the Terence Higgins Trust. So welcome, Hugh.
Thanks for having me.
To the webinar. We're going to look through a number of different things this afternoon around sexual health. And also, just before we do that, I just want to thank our IT students from Huntingdon Regional College for facilitating the IT infrastructure. So thank you to them. As I said, we're going to look at what sexual health is. We're also going to be provided with an overview of what sexually transmitted infections are. And Hugh will also talk through the testing and treatment options that are available. And we'll also provide some further information around prevention and other sources of support. So Hugh, over to you really.
Looking at the webinars that has already been done around sort of the holistic approach to health, I looked at what is sexual health. And sexual health, according to the World Health Organization, is a state of physical, mental and social well-being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination and violence. And you can see there how it fits into sort of like mental health and well-being.
Mm-hmm. Excellent. Okay, so we've got some statistics around from public health looking at the diagnoses of sexually transmitted infections, STIs. Do you want to talk us through this slide?
Absolutely. This is we always work on a year previous, so these are 2015 figures. In the UK there's 435, so nearly 500,000 new sexually transmitted infections across the UK, including chlamydia being the most prolific one, genital warts, gonorrhea and other STIs, sexually transmitted infections. The one area of concern that we most have is that the biggest impact of sexually transmitted infections is on the age of under 25s, and their highest risk of chlamydia, with over 60% of new infections of chlamydia being in the 15 to 24 age bracket, and gonorrhea, genital warts and genital herpes. There's about just over 1,000 cases in Cambridgeshire alone of chlamydia in 15 to 24 age bracket.
Okay, so actually that sort of significant area are in heterosexuals under the age of 25 and also in men who have sex with men.
Yes.
Okay. Okay, so we've got some more statistics here. Do you want to talk us through what Public Health England are saying?
Yes, we have, and Terence Higgins Trust in Cambridgeshire carry out the National Chlamydia Screening Programme, where the aim is, the national average is about 1 in 10 young people under the age of between the age of 15 to 24, mm-hmm. who are sexually active, who have chlamydia. So because chlamydia might have no signs or symptoms, then it's a big risk area. So 62% of new infections in that age bracket of chlamydia nationally. So we go out and we screen as many possible people as we can. And in the UK in 2015, we did over 1.5 million chlamydia tests. And of that, we've got 129,000 diagnoses. And this is just in the 15 to 24 age bracket.
Gosh, okay, wow. So some really important work going into that public health agenda, which is fantastic. So we talk about sexually transmitted infections. Sort of, in what form do they come?
Okay. We basically break them down into viral, bacterial or parasitic infections. The viral infections being HIV, hepatitis, genital warts, herpes or molluscum contagiosum, which sounds a bit like something from Harry Potter. And then bacterial, we have chlamydia, gonorrhea, syphilis, and parasites, something like Trichomonas vaginalis, pubic lice or scabies.
Okay. And Hugh, how are sexually transmitted infections transmitted?
Absolutely, that's an important thing to know how to keep safe. So the biggest route of transmission, obviously, is through unprotected sexual intercourse, either vaginal, anal or oral, sharing of sex toys, skin-to-skin contact, or mother-to-child. So those are the most common ones. And,
Sure.
and again, there's just over 20 different types of sexually transmitted infections, and we're looking at the most common ones.
Okay, and if someone is concerned about their sexual health, what would the signs and symptoms be, possibly?
Okay. It's not an exhaustive list,
Sure.
so at the end of the day we would encourage people to go and get checked out, whatever their concerns. Some of the most common ones are pain and burning whilst urinating, a different discharge or a discharge that isn't normally there, abdominal pain, painful or swollen testicles, growths, blisters or sores, bleeding between periods, pain during sex, or, quite as I said, quite importantly, some have no signs or symptoms, so you might have an infection and not know that you've got it, which is where regular screening helps. The emphasis is make sure that you know what your body looks like, feels like, smells like, and then if anything changes, go and get yourself checked out.
So essentially the message is if there is a small change or a change, then go and get it checked out.
Yep.
And where do people go and get tested and treatment from?
Okay. As I was saying, the National Committee Screening Programme is available in outreach settings, so you might see us pubs, clubs, community events, and then in Cambridgeshire we have the iCash clinics, and Clinic 6 in Huntingdon, Limetree in Cambridge, Parkside in Wisbech, where they're set up for sexually transmitted infections, contraception. They're used to dealing with people. There's nothing that they haven't seen before. They're really, really friendly, and they usually have some access for young people, so they might have a young people's drop-in.
Oh, okay, excellent. And the testing, what does it look like? What's the process?
Part of this is removing some of the fear that people have about understanding how you get tested, but it's very, very simple. So with boys it might be, or girls might be a urine sample, might be a self-taken swab, and if you're in the clinic then they might take a blood sample. They would only do an examination if there was any signs or symptoms, so it can be very simple, pain-free, straightforward. The point being is that we're trying to remove any fear and build regular testing into people's lives.
Sure, thank you. And also, so moving on around the treatment, Hugh, of STIs, what treatments are provided?
The most common ones with the bacterial infection are just antibiotics.
Okay, so a course of antibiotics.
Yeah, so those the bacterial infections are quite easy to treat and get rid of.
Mm-hmm.
Parasitic infections might be a lotion, for example, something over the counter from the chemist.
Mm-hmm.
And for some of the viruses it might be a topical cream for warts, it might be cryotherapy, which is freezing off. But with viruses, once you've got the virus, you can't get rid of the virus, you can only treat the symptoms. So it'd be treatment by managing the condition as opposed to curing the condition.
And what happens if there is no treatment, if treatment isn't undergone, so if the individual doesn't actually go and present and say they need treatment, what might be the consequence of that?
Yeah. Well, some of the things, particularly with chlamydia, we look at untreated chlamydia can lead on to other more serious consequences. So chlamydia might lead on to epididymitis in men, which is blocking of the tubes at the back of the testes that produce the sperm, which can lead to be painful, and can lead, if left untreated, can lead to sterility, not being able to have kids. And also similarly in women, then it can lead on to pelvic inflammatory disease, which can be very, very painful. It blocks all the tubes, might lead to ectopic pregnancies, and again could have a possibility of leaving the person infertile.
Okay, thank you, Hugh.
So the earlier treatment
is recommended. Yeah, definitely. That sounds like a very clear message. So around prevention, obviously lots of people doing lots of work around prevention. What does prevention look like?
best way for prevention around sexual health and keeping yourself safe from sexually transmitted infections is using a barrier form of protection. So that's either condoms or femidoms or dental dams. We can say that abstinence works where people don't have sexual intercourse outside of marriage, or we can say, you know, are you ready for, you know, having an active sex life? Just because you've had sex once does not mean to say that you have to have it again. If you don't think that you're ready to do that, you can stop, and that's okay. Monogamy, so people staying in one-to-one relationships and perhaps reducing the number of sexual partners and avoid overlapping sexual partners, so that you can't have that mixing of infections if the risk is there. You can get vaccinated against some of the infections, like hepatitis, and the HPV vaccine, which guards against some of the genital warts viruses. And there is post-exposure prophylaxis to help if you think you might have been at risk of HIV exposure. Go to a clinic or to GP or to accident and emergency, where they will make an assessment and offer you some medication if you've been at risk.
It sounds like the overall message here is that it's really always to have protected sexual intercourse.
Yeah. Protected sexual intercourse, and if you're unsure of anything, you know, come and have a chat at one of the clinics. That's absolutely fine, or with any of the members of staff doing the outreach testing. We would rather you would be informed and make informed decisions rather than carry on in the dark.
Yeah, absolutely. So if unsure, there are lots of great support and advice agencies out there who can work with young people and adults.
Yeah,
great.
And all of the team at the clinics and with our screening program, they're all used to working with young people. And we want to get across the message that at the end of the day, regular screening built into your whole lifestyle, so that into your general health, can also prevent STIs, because it can check and stop and get early identification can lead to reducing the incidences of passing it on, and better your chances of a full recovery if any treatment is needed.
Okay, excellent. So also sexually active under 25-year-olds should be screened for chlamydia every year approximately, is that?
Yeah, approximately every year, or on a change of partner.
Sure, okay, excellent, thank you. Okay, so we've also got some further information from the iCash website, which is the Integrated Contraception and Sexual Health Services for Cambridgeshire, Norfolk, Peterborough and Suffolk. So you can access a range of information and resources about contraception and sexual health, sex and relationships from that website. And the website is www.icash.nhs.uk. And Hugh, do you want to talk about the Cambridgeshire Condom card?
Absolutely. So the Cambridgeshire Condom card, C-card scheme, is anywhere that you see that sign, and you can get, so anybody that's 13 to 24 can get access to free condoms, free dental dams, latex-free condoms and lube. Doesn't cost anything. You just have to go and sign up. You will have a one-to-one anywhere that you see that sign, be it chemists, youth clubs, colleges, school nurses, clinics. They'll give you a one-to-one around safeguarding. At the end of the day, it's a confidential service, but we want to make sure that you understand what you're signing up to, that there's no safeguarding issues, you're not at risk of harm to yourself or to anybody else. And if that's okay, you don't need to tell anybody. Get the card and go and produce that card, get 12 condoms a time, and you know you see the sign.
Okay, so it's a really great scheme, so thank you for highlighting that. We've also got a range of other sources of information to share with our listeners and viewers. So we've got here just, sort of the Terence Higgins Trust website, iCash in Cambridgeshire, Diverse, Sexuality, FPA, Centre 33 and Inclusion. So some really good points to access a range of different information.
And it's just building in that it falls in your sexual health, you have a right to, and it falls within that whole holistic approach.
Excellent. Okay. Well, we'll keep the further information up on the slides. We've had a couple of questions come in. So the first question is: I'm 15 years old and in a relationship. I want to go on the pill, but I don't want my parents to know. Do I have to tell them?
Absolutely not. As I was saying, all of the ICAS clinics are a confidential service. You don't have to tell anybody that you're going or that you've been. As I said, the emphasis around is around the client and safeguarding, so you will have to have a one-to-one to make sure that you understand that the treatment options that you're being given, and also that you're not at risk of harm, so nobody's coercing you into sexual activity, and you're not going to be at risk to anybody else. So all of the ICAS clinics are confidential. No information is passed to anybody else or to GPs or any other services outside. We won't automatically tell parents. We would encourage you to talk to either a family member or an adult in relation, so that you've got somebody there to talk to around sexual health, be that parent, teacher, sibling, youth worker, going forward.
It's really important to have that support network, isn't it?
Yes.
I imagine so. Okay, our second question is: I'm really worried. I had sex with my girlfriend and the condom split. What advice would we give?
Okay, so first off, you need to go and see if you want access to emergency contraception, and there's a couple of choices for you. You can go to a pharmacy and within 72 hours and get over-the-counter emergency contraception. Again, you will have a safeguarding interview. You can get over-the-counter at the pharmacies. You can go to A&E, you can go to the ICAS clinic, you can go to the GP, so the sooner the better. You've probably got about 5 days for medication, and then if it's 5 days or longer, you need to go to the GP or the ICAS clinic to have a consultation. There are options for you. Going forward, check that you're using condoms correctly, because some lubricants can eat through the condoms. Even if you're putting the condom on the wrong way round, then it might be a case of splitting. So checking in condom use as well, and also then perhaps talking with your girlfriend and saying, well, what other options have we got? We would always recommend using some form of contraception against pregnancy, and a barrier protection against sexually transmitted infections together, and then going forward, if get screened, and then if you want to stop using condoms, you can.
Okay, so some great advice there. Thank you, Hugh. I've got another question. I'm a virgin and I only have oral sex. What STIs can I get?
Okay. The bacterial infections you can get through contact with sex fluids, and also some of the infections you can get through skin-to-skin contact. So you're still possibly susceptible to those. Again, build checking into your getting tested into your regular activity and your health, and we do recommend using condoms or dental dams or fentanyl for oral sex.
Okay, I think we've got time for one more question.
Okay.
The question is: I'm 18 and really not interested in sex at all. Am I normal?
Absolutely. We are human beings. We have a very diverse nature, and just because that you don't want to have sex does not mean to say that there's anything wrong with you. It might be termed that this person is asexual, where they don't want any sexual activity either inside or outside a relationship, and that's absolutely fine. There's a lot of people out there that feel the same way. Also termed as ace. You can look at the website page, and if you go to Sexuality, who are the LGBT plus support organisation in Cambridgeshire, then they can give you some more information. As I said, we're all diverse, we all fall on a spectrum, and Sexuality deals with that spectrum.
Okay, well, thank you, Hugh. I want to sort of thank everybody for joining our webinar on looking after sexual health. No, thank you. And just want to obviously thank the Terence Higgins Trust, ICAS and Cambridgeshire County Council, and our students here at Huntingdon Regional College for bringing this important webinar together. So thank you.
Thank you.